everyone. My name is Wändi Bruine de Bruin, and I'm a Provost Professor of Public Policy, Psychology, and Behavioral Science at the University of Southern California. Today, I will be presenting a paper entitled Relationships Between Perceived Analogies of COVID-19 and Protective Behaviors, Evidence from a National Survey. This is a paper I worked on with Carman and Wändi Parker, and both of them are at the Rand Corporation. Before I start, I'd like to thank my funders. They are listed at the bottom of the screen. I would also like to thank my colleagues at the University of Southern California's Center for Economic and Social Research, who have been collecting data on a COVID-19 tracking survey that we used for this specific paper. I'll tell you more about it in a minute or so. So our paper is on analogies, and analogies are often used by people to understand new information. And in March 2020, COVID-19 was a novel threat. It had just entered the United States and was rapidly spreading. Now, if you use analogies to understand new information, those analogies can help or hurt. So for example, people who associate smallpox with chickenpox may better understand the disease process. But it's also been found that thinking of smallpox as being like chickenpox may lead to thinking that smallpox mostly affects children, which is of course not the case. And as early as March 2020, Trump was comparing coronavirus to the seasonal flu. And although websites such as this one that you see here from NPR were saying that this is incorrect information and coronavirus could be 10 times deadlier than the seasonal flu, it may have still been a common analogy. And of course, if people use seasonal flu as an analogy for COVID-19, they may not be as willing to implement protective behaviors such as hand washing or social distancing. We had the following research questions for our paper. First, in March 2020, which analogies did people use for COVID-19? And second, how were those analogies associated with their self-reported protective behaviors, such as hand washing and social distancing? And as I noted earlier, our colleagues at the University of Southern California's Center for Economic and Social Research started a COVID-19 survey in March 2020. And since March 2020, they have been tracking how Americans have been doing. So every 2 weeks, they ask their participants to report protective behaviors such as hand washing and social distancing, as well as risk perceptions for getting infected, dying if infected, running out of money, and so on. And in March 2020, our team added a question about analogies people had in mind when thinking of COVID-19. And I'll discuss the question wording on the next slide. This COVID-19 survey was conducted with a nationally representative sample recruited through USC's Understanding America study. And the Understanding America study is a random address-based sample. So it's nationally representative for the United States. So the survey that our question was on ran from March 10th to the 31st of 2020. We had a sample of 6,684 participants, and 48% were male, 63% were white, 16% Hispanic, and 12% African American. Mean age was 48, with 20% being over the age of 65, putting them at higher risk of negative consequences from COVID-19. And then our question on this survey asked, when you think of the coronavirus or COVID-19, what other diseases come to mind? And that question was then followed by 3 text boxes, so participants could provide up to 3 analogies for COVID-19. Our question about analogies was asked at the end of the survey. So earlier on, participants had already reported whether or not they had implemented the following protective behaviors: washing hands with soap or using hand sanitizer several times a day, avoiding public spaces or crowds, which is social distancing, avoiding contact with people who could be high risk, and canceling or postponing travel. And then they also answered risk perceptions, such as on a scale from 0 to 100%, what is the chance that you will get the coronavirus in the next 3 months? As well as, if you do get infected with the coronavirus, what is the chance that you will die from it? And those questions were answered on a 0 to 100% visual linear scale. So let's look at the first research question. In March 2020, which analogies did people use for COVID-19? And here is the list of analogies that participants generated. And mind you, they could generate more than one. So in the blue box, you see common infectious diseases that people thought of. And the majority of participants thought of seasonal influenza. 59% did so. Then 10% thought of the common cold, and 9% thought of pneumonia. Some participants also, or instead, thought of emergent infectious diseases. 28% thought of pandemic influenza, or Spanish flu, or H1N1. 26% thought of SARS or MERS, and 14% thought of Ebola. It was also the case that if participants mentioned one common infectious disease, they also tended to mention another. And they tended to not mention emergent infectious diseases. Similarly, participants who thought of one emergent infectious disease also tended to think of another and tended to not think of a common infectious disease. So common infectious diseases appeared together and emergent infectious diseases appeared together generally in people's responses to questions about analogies. And another thing that I should note is that intercoder agreement was high. So Cohen's kappa was 0.95 or higher for each of these diseases. Second question that we wanted to look at is how were those analogies associated with people's self-reported protective behaviors? Well, first I should note, as early as March 2020, a majority of participants was already indicated that they were engaging in self-reported protective behaviors. So 90% reported washing their hands more, and this was in March 2020, the behavior that most communications were focusing on. In addition to that, 57% were already avoiding public spaces or crowds, and this was before a lot of states were on any type of lockdown. 58% of participants in March 2020 said that they were avoiding high-risk individuals, and then 37% said that they were canceling or postponing travel. But of course, that depends on whether you had any travel booked to begin with. Now, here you see how the use of these analogies was associated with reporting protective behaviors. So first, I should note that the dark blue bar reflects thinking of seasonal influenza as an analogy for COVID-19, and then the lighter blue bar reflects thinking of the common cold as an analogy for COVID-19. And generally, those blue bars are lower than the other bars. So people who thought of seasonal influenza or the common cold as an analogy for COVID-19 tended to report that they were engaging less in washing hands, avoiding crowds, avoiding high-risk individuals, and canceling and postponing travel, as compared to people who thought of any of the other diseases. Then another thing to note is the white bar that reflects people who thought of pneumonia as an analogy for COVID-19. That bar tends to be relatively high, perhaps higher than for many of the behaviors higher than any of the other things that people thought of. So pneumonia is a common infectious disease, but despite it being a common infectious disease, people who thought of COVID-19 as being like pneumonia tended to report more of the protective behaviors. Then finally, the red bars reflect pandemic influenza, SARS or MERS, and Ebola. And those red bars tend to indicate that people reported more of the protective behaviors than people who thought of seasonal influenza and cold. And this pattern is basically confirmed in logistic regressions. Now, those logistic regressions are important because they predicted the different protective behaviors while accounting for other analogies that people thought of, as well as accounting for risk perceptions and demographics. So first, let's look at the blue lines in this table. Those are reflect the people who thought of seasonal flu or common cold as analogies for COVID-19. Where the numbers are significant, they are below 1. And so these are odds ratios, and odds ratios below 1 suggest that people who thought of these analogies were less likely to engage in the behaviors. So, for example, people who thought of seasonal flu and people who thought of common cold as an analogy for COVID-19 were less likely to cancel travel, as you can see in the last column. And then also people who thought of the common cold as an analogy for COVID-19 were less likely to avoid crowds. Now, the next line is in white, and that's for pneumonia. And you see that for pneumonia, the significant odds ratios are above 1, suggesting that participants who thought of pneumonia were more likely to implement protective behaviors, including washing hands, avoiding crowds, and avoiding high-risk individuals. Then the red lines in the table reflect using pandemic flu, SARS, MERS, or Ebola as an analogy for COVID-19. And where the odds ratios are significant, they are above 1, suggesting that people who thought more of those diseases as analogies for COVID-19 were more likely to report protective behaviors. And then another thing to note is that pneumonia predicted 3 out of the 4 protective behaviors, and the only other analogy for which that was also the case was Ebola. So basically, thinking of pneumonia or Ebola as an analogy for COVID-19 increased protective behaviors the most compared to anything else. So overall, early on in the pandemic, people in the United States associated COVID-19 with common and emergent infectious diseases. Thinking of COVID-19 as seasonal flu tended to be associated with engaging less in protective behaviors. Thinking of COVID-19 instead as being more similar to pneumonia or Ebola tended to be associated with engaging more in protective behaviors, such as hand washing and social distancing. And these findings held when accounting for risk perceptions and demographics. So in conclusion, the most effective analogy to use in health communications about COVID-19 should be the one that resonates with people and that promotes protective behaviors. But of course, the analogy should also be accurate in the perception of healthcare workers. So our data suggests that if you think of COVID-19 as being similar to pneumonia or Ebola, you're more likely to engage in protective behaviors. But it might be the case that healthcare workers might prefer the analogy with pneumonia more than the analogy with Ebola. Now, the limitation of our work is that it's correlational in nature. These were the analogies that people self-reported, and they also self-reported protective behaviors. Correlation does not mean causation. To test the effectiveness of analogies, what we would need to do is randomly assign participants to messages that highlight different analogies. And then if it is indeed the case that thinking of COVID-19 as pneumonia, if that's more effective, then messages that focus on pneumonia as an analogy for COVID-19 should lead to more protective behaviors such as hand washing and social distancing. And before I end, I want to point you to several other papers we have written on COVID-19 on the basis of this nationally representative data set. And if you are interested in any of these papers, please email me and I'll be happy to share them. Thank you very much for your attention, and I look forward to your questions.